So, hi, my name's Lucy Adams. I'm one of the anaesthetists here working at the Northumbria Healthcare Trust, and I just wanted to speak with you for a few minutes about our involvement in the care of maternity patients when they come in for delivery. So, one of the aspects that we're very focused on is helping women with pain relief in labour, and we very much advocate an approach where patients take on pain relief in a stepwise fashion depending on how bad their pain is. So in the early stages of labour, we'd be very much encouraging the simple measures, simple tablets to help. And then as labour progresses, we're looking at stronger pain relief medicines such as gas and air or injections of opiates to try and help. If that's not enough, then that's where we come in to help you with what we call a labour epidural. And we're very happy to come and have a chat with you 24/7 about having an epidural for pain relief. There are actually some women that we would actually recommend an epidural for medical reasons, but for the vast majority it's choice, and we can come and have a chat with you and talk you through how we would place that and some of the benefits and risks associated with it. Epidurals are an excellent form of pain relief, an extremely popular choice. And what we're aiming for is a situation where you feel nice and relaxed and the intensity of the pain is gone, but you still retain some sensations and some an awareness of the need to push when the time comes. We also very much try and avoid those dense heaviness of the legs that can happen, and we're very much keen to keep women moving around the bed, and your midwives will help with that once an epidural is in situ. It is really important that once an epidural is in, that we monitor you and your baby closely, so you will be more confined to the bed. So the midwives will help you into different positions, and we'll be using pieces of equipment like the peanut ball, which is like a birthing ball, but facilitates getting you in comfortable position that aids the delivery of your baby. So moving on from pain relief, the other area where we may meet you is if you needed some type of operative delivery, whether that be a forceps delivery or even a caesarean section. And if this situation happened, an anaesthetist would come and visit you, ask you a few questions and talk you through options for anaesthesia. I must say that we do know that it is strongly beneficial for you to remain awake for any surgical procedures, as we know that this has medical benefits for both you and your baby. All right, but on occasion there are times when we may need to consider general anaesthesia, but again your anaesthetist would discuss that with you at the time. What we more often go for is a technique called a spinal anaesthetic. This again is an injection in your back and will numb you and make you comfortable for the procedure. Through any procedure, an anaesthetist will be with you throughout, so that if there are any problems, just let them know and they will talk you through the best course of action. It is worth noting that if you had an epidural for labour, then again we may be able to utilise that to make you comfortable for any surgical procedure, but that is something that the anaesthetist would decide at that time. Just to make you aware, if you have had involvement of an anaesthetist in your care while you are with us, then you will get follow-up postnatally. An anaesthetist will come and visit you on the ward just to check that you are happy with the service we provided, but also that there are no problems after the injections you've had. One other aspect just might be worth mentioning is that we do run an anaesthetic antenatal clinic. And that there are some women who may have some medical conditions that might have a bearing on what we do throughout their delivery, and you would be offered an appointment either face-to-face or sometimes just by the telephone to talk with an anaesthetist, recommend or advise certain techniques which we would obviously talk through with you.